Preterm births are responsible for 75% of neonatal mortality and 50% of long-term neurological impairments in children. In the United States, about 12% of babies, more than 500,000 per year, are born prematurely. Researchers have identified some modifiable lifestyle risk factors associated with preterm births that can be addressed during pregnancy. Timely screening and management of modifiable risks can potentially reduce risks for preterm labor. Yet, providing effective prenatal risk management to meet the unique needs of higher risk women is complex. PHCC has designed and tested a clinic-based computer-assisted intervention system to reduce preterm births among high-risk women. In our recent efficacy trial, preterm births were reduced by 34%. This system assesses a pregnant woman's unique risks in 6 modifiable areas associated with increased risks of preterm birth, provides her with tailored advice and action planning tools to help her reduce her risks, provides her certified nurse midwife, physician, or other clinician with details on her assessed risks and counseling suggestions tailored for her needs, and promotes effective referrals to and successful linkages with community-based support organizations when needed. The modifiable risk factors addressed by this program include smoking, poor nutrition and inadequate or excessive maternal weight gain, domestic violence, maternal depression and stress, urinary and reproductive tract infections, and substance abuse. This is the first screen of this internet-based software program. It is what a woman sees when she opens the program. To begin, she enters a specific code that has been provided by her clinician, ACO care manager, your website, a member newsletter, or other source. The program then guides a patient through a series of screens that assess risk in each area. Here you see a sample from the smoking cessation section. Depending on the woman's answers, the program gathers more specific risk data or moves on to the next risk area. As she works through the program, the software is constructing a tailored report. This report is immediately available at the end of the program. She can view it, print it, or have it emailed to a specified address. The tailored reports are typically 2 to 3 pages, depending on the number of risks the woman has identified. Here is a sample 3-page report. The reports cover all 6 risk areas. Positive encouragement is given in areas where she does not have a risk, and content reinforces the good things she is doing to help her baby. An option is to provide a more detailed collateral educational booklet. This gives the woman additional information on her health risks, how these can affect her baby, and ideas to reduce her risks. It is segmented so she can go right to the areas where she has more needs. The tailored reports can refer to specific content sections in this booklet. As the tailored report is constructed for the woman, another report is being constructed for the caregiver. Based on acceptability testing with providers, this brief report highlights key areas of concern. During consumer acceptability testing, some women reported that they felt more comfortable answering questions on the computer than talking with a doctor or nurse midwife. Multiple caregivers can receive copies of this tailored report. In PHCC's efficacy trial with 482 women, funded by the National Institutes of Health, 13.8% in the intervention group had babies less than 2,500 grams, compared to 19% in the control group. This equated to about a 34% reduction in preterm births. Here are a few key points regarding the design of the program. The emphasis is on patient self-management and patient-derived actionable goals. Your caregivers may be in a good position to help many high-risk pregnant women access and use the software, address risks and interests they identified, and monitor risk reduction during the pregnancy. A process to introduce patients to the program can be customized for your needs. This includes preparing a basic description of the program, how to access the URL, an access code, and how to use it. Additional information on evidence, specific content covered in each topic area, ways to adapt a program for your unique needs, etc., is available.